a pregnant lady or a pregnant woman might be exposed to or infected with. Of course, we have to know something about the COVID-19 infection during a pregnancy, because it is the virus of the current pandemic, as you know. And of course, there are many studies and researches are still ongoing and will continue ongoing. But it is afforded to mention some of the updated guidelines about this infection during pregnancy that is available till the time of presenting this lecture. Starting from the main advice for those who are pregnant. In the general population, all of them should be informed that there is no evidence for the time being that suggests that a pregnant lady are more likely to get seriously ill from coronavirus, but they have been included in the list of people at moderate risk as a precaution. وأعتقد واضحة هاي العبارة. زين. What are the key advice for a pregnant woman during the pandemic? It is حقيقة the same as for the general population. Example is through following the guidance of safety by staying alert, and consideration should be given for appropriate social distancing, and should stay safe outside home, especially with the use of appropriate face coverings. As well as, because the pregnancy state by itself is a hypercoagulable state, because hypercoagulability is increased because of the increased clotting factors. Therefore, they should be encouraged to keep mobile and stay well hydrated to reduce the risk of bloody clots in a pregnancy. All the pregnant ladies should be advised to stay active and practice regular exercise, and a healthy balanced diet should be encouraged with folic acid and vitamin D supplementation. What about the effect of does coronavirus have on a pregnant woman? It has been suggested that there is no greater risk of becoming seriously unwell than other healthy adults if they develop coronavirus. So the large majority of pregnant ladies experience only mild or moderate symptoms. But Black, Asian, and a minority of ethnic backgrounds have been found to be more likely than other women to have a serious disease that requires or necessitates admission to the hospital. As well, those women who are over the age of 35 and those who are obese with a BMI of 30 or more, and as well those with the pre-existing medical conditions, for example, hypertension, diabetes, etc. But you have to know that there is no evidence to suggest an increased risk of miscarriage in any pregnant ladies who become infected with coronavirus. In general, what are the guidelines of management of COVID-19 during the pregnancy? First of all, fetal and uterine contraction should be monitored. Of course, this depends on the gestational age at the time of maternal infection. Regarding the delivery planning, this should be individualized for each particular woman according to an obstetric indications, fetal indications, etc. As well, a multidisciplinary team-based approach should be adopted. That is to say, this may include consultation with an obstetrician, maternal fetal medicine specialist, infectious disease specialist, pulmonary and critical care specialist, pediatrician as appropriate. And an important thing you have to know that it is very important to stress on that fact. The treatment guidelines for COVID-19 that is recommended for the general population should not be withheld from a pregnant woman because of theoretical concerns related to safety of therapeutic agents in pregnancy. يعني شو نقصد إنه guidelines for treatment in general, يعني whatever the patients need, for example, anticoagulant, etc., should be given to the pregnant women وما نخلي اعتبار للsafety of the fetus. ليش؟ لأنه تعرفون إنه maternal life is our priority, maternal health in this situation, because it might become a fatal situation in any infected individual. We are going to discuss I'm going to present you something about the most famous protozoal infection that represents حقيقة that fear in any lady who become pregnant. يعني حقيقة أنا يجوني يعني نشوفهم بالout patients clinic. Once they go to marry, they become feared from what is known as toxoplasmosis. Because unfortunately, this infection with toxoplasmosis has been overdiagnosed and overtreated, طبعا wrongly, incorrectly, by a number of physicians or doctors. ليش؟ هسه نعرف ليش من خلال the following next few slides. To start with, you have to know what is toxoplasmosis, or what does cause. Toxoplasma gondii, it is an intracellular parasite. It infects humans and all warm-blooded animals. طبعا ده القطط احنا نسميه بالعامية. How a human become infected with toxoplasmosis? This happened either by eating raw or undercooked meat that is infected with tissue cyst, or through contact with oocytes from infected cat feces in contaminated litter, soil, or water, or it is transmitted vertically from infected mother to her fetus through the placenta. All these modes of transmission might be a possibility. The incidence and severity of congenital infection depends on the fetal age, طبعا as with other infectious agents, at the time of maternal infection. It has been found that the risk of fetal infection, although increases during pregnancy with advancing gestation, but the severity of fetal infection is much greater in early pregnancy. يعني شنو؟ يعني risk of vertical transmission يزيد ويا تقدم الحمل from, for example, 10 up to 9% at the first trimester and maybe increased up to 81% if it does occur in the third trimester. What about the pathogenesis? هنا لو تشوفون هذا الفيجر تشوفون أنه Toxoplasma gondii has two hosts. The definitive host is the cats, the digestive epithelium of cats, while the intermediate hosts are the mammals and birds. How the cats becomes infected? It becomes infected when it ingests a flesh contaminated with tissue cyst of the parasite. And after becoming infected, it excretes millions of oocytes a day. And these oocytes become sporulated within 1 to 2 days. And after becoming sporulated, it will be highly infectious. So any human being, when becomes contaminated with or becomes in contact with a contaminated food, water, or soil, or litter, they will be infected, or they will acquire the parasite. As well, a human being, when ingest or when eats undercooked meat, or uncooked meat that is infested with tissue cysts with Toxoplasma gondii, they will acquire the infection as well. And the human being or the pregnant ladies, when become infected, it will transmit the parasite through or the trophozoa in the form of tachyzoids through the placenta to her developing embryo or fetus. And the fetus will become congenitally infected after that. So, in general, it has a complex life cycle with sexual reproduction taking place in the definitive host, while asexual reproduction in the intermediate host. Okay. What about routine screening for Toxoplasma gondii? Till now, the guidelines recommend that routine antenatal screening for toxoplasmosis is not recommended. Why? Because the risk of screening may outweigh the potential benefits. What about the clinical manifestations of toxoplasmosis during a pregnancy? To start with, you have to know that the incubation period is from 5 up to 18 days following exposure. Most infections are silent, so the pregnant ladies are asymptomatic in more than 90% of cases. Others may experience flu-like illnesses, for example, fatigue, uh, flu-like illness as posterior cervical lymphadenopathy, fever, malaise, etc. In immunocompetent adults, initial infection usually confers immunity. يعني شنو؟ يعني تنطيها مناعة. Therefore, a pre-pregnancy infection nearly eliminates any risk of vertical transmission if they become reinfected again during their pregnancies. لذلك, any lady who are screened before becoming pregnant for the presence of the IgG antibodies, for example, for the parasite Toxoplasmosis, they should be regarded as they have no increased risk of transmitting Toxoplasma gondii to their fetuses. However, in immunocompromised individuals, serious complications might occur. For example, severe encephalitis, myocarditis, pneumonitis, or hepatitis. As well, infected pregnant ladies will have a fourfold increased preterm delivery rate. Most infected fetuses are born without obvious stigmata of toxoplasmosis on routine examination. يعني شنو؟ يعني يجون the newborn babies born with no clinical evidence of infection. However, though others might present with features of congenital toxoplasmosis that is characterized by the tetrad of chorioretinitis, hydrocephalus, intracranial calcification, and convulsions. Of course, diagnosis is difficult. Prenatal antenatal diagnosis of toxoplasma infection of the fetus is difficult, but the ultrasound features that will be suggestive of fetal infection in utero is the presence of intracranial calcification, microcephaly, hydrocephaly, intrauterine growth restriction, in the presence of documented maternal infection with toxoplasmosis. What about the diagnosis? It is very important to know that the parasite is rarely detected in tissue or body fluids. Therefore, the diagnosis relies on serological testing for specific antibodies. هنا حقيقة المشكلة اللي أحب أوضحها واللي هي سببت في التشخيص الخاطئ عند معظم الأطباء العامين أو يعني الممارسين. حقيقة they interpret the results incorrectly. هنا هاي الفاكتس لازم نركز عليها اللي هي شنو؟ احنا قلنا serological testing is the way or the method in which we can detect the presence of the parasite or the infection, acute infections. لكن شلون؟ اكو few important facts. أولاً anti-toxoplasma IgG antibody develops within 2 up to 4 weeks after infection, peaks at 2 to 3 months, and then stabilizes at a plateau for several months before decreasing to very low levels persisting for life. وهنا انتبهوا على هاي العبارة إنه persisting for life يعني شنو؟ يعني at any time we screen for the presence of anti-toxoplasma IgG antibodies we can found that these are present. وهذا مو معناتها أكو إصابة، لا، هي مناعة، يعني احتمال they acquire the infection during, for example, their childhood. هاي واحدة. ومثل ما قلنا إنه a positive IgG test before pregnancy means that the fetus will not be at risk. What about the IgG antibodies? IgG antibodies appear by 1 to 2 weeks before IgG, and after that it increases for 1 month, then persists for a variable period of time that may remain detectable for years. يعني انتبهوا انه IgM antibody ممكن سنوات يبقى. لذلك the presence of these antibodies should not be used alone to diagnose acute toxoplasmosis. Okay? لعد نعتمد على شنو في التشخيص؟ أولاً بديهية الشغلة إنه absence of IgM antibodies in the presence of IgG antibodies, this will exclude recent infection. لكن إذا اثنيناتهم لقيناهم IgM والIgG هاي مو معناته إنه البيشنت really has acute infection. يعني مثل ما قلنا IgM antibodies may remain detectable for years. إذا نعتمد على شنو؟ نعتمد على فقرة مهمة اللي هي شنو؟ something يسموه IgG avidity. avidity شنو معناته؟ معناته it measures the strength of antigen antibody binding. And this has found to be increases with increasing time elapsed since infection, since the time of infection. فإذا شنو معناته؟ معناته high avidity allows the exclusion of an infection that is acquired in the last 12 up to 20 weeks. يعني شنو؟ يعني فرضاً إذا لقينا أنه أكو high avidity during the first trimester, this will exclude an infection took place during a pregnancy. يعني first trimester هو 12 أسبوع ومثل ما قلنا أقل شيء أنه مضى 12 أسبوع إلى 20 أسبوع من وقت الإصابة يلا avidity becomes high. Okay. What about the prenatal diagnosis of toxoplasmosis? مثل ما قلنا the gold standard diagnostic technique for any infectious agents is by doing the polymerase chain reaction of amniotic fluid obtained via amniocentesis or fetal blood obtained via choriocentesis. However, the sonographic features that might be suggestive مثل ما قلنا in any woman with a documented infection with toxoplasmosis will be intracranial, the presence of intracranial calcifications, hydrocephaly, liver calcifications, ascites, placental thickening, hyperechoic bowel, and growth restriction. Now, what about the management? Of course, pregnant women should be informed of the primary prevention measures. يعني شنو؟ يعني special attention should be made to preventing contamination from infected soil, water, litter, especially during gardening, during handling of the litter, etc. As well, they should be discouraged from eating raw or undercooked meat. And if they become infected, they can be treated with spiromycin. Spiromycin will eradicate the parasites in the pregnant lady and reduce the risk of congenital infection, but it will not treat established fetal infection. يعني شنو؟ يعني إذا ثبت عندنا من خلال ال PCR of amniotic fluid or of the fetal blood or من خلال the presence of the ultrasound features that are suggestive of fetal infection, spiromycin alone will not be enough to eradicate the parasite in the placenta and fetus. And here, in cases of approved fetal infection, a combination of pyrimethamine, sulfadiazine, and folinic acid should be prescribed for the woman in order to treat the fetus from the current infection. Okay. طبعا ليش الفولينيك اسيد ننطيه؟ لأن مثل ما تعرفون البايريميثامين هو عبارة عن يعني tetrahydrofolate reductase inhibitor فيمنع conversion of folic acid into folinic acid. Over 90% of neonates مثل ما قلنا with congenital infection will show no clinical signs of infection at birth. However, if not treated, they will be at risk of developing long-term sequelae in the form of chorioretinal disease, major neurological abnormalities, psychomotor retardation, and mental impairments. Now I will present to you something about another famous example of an infectious agents that might affect the fetus if the mother becomes infected with. This is the syphilitic infection. To start with, what causes syphilis? The syphilis is caused by Treponema pallidum, which is a gram-negative bacterium. How a woman becomes infected, يعني, or what is the source of infection from this agent, is via minute abrasions on the vaginal mucosa, وقد يكون كذلك oral mucosa or anal mucosa. And this will provide a portal of entry for the spirochetes. After that, they will replicate and disseminate through the lymphatic channels within hours or days. طبعا the incubation period ranges from 3 to 3 months, 3 weeks to up to 3 months. This depends on host factors and inoculum size. يعني شلون؟ يعني during, for example, the early stages of syphilis, because of the highest spirochete loads. early stages of syphilis مثل ما تعرفون يشمل the primary stage, secondary stage, and early latent syphilis. This will be associated with the highest vertical transmission rates of up to 100%, يعني from 60 up to 100%. However, it will be 40% with early latent infection, and with late latent disease, it is much lower and not exceeding 8%. And this figure shows the spirochetes or Treponema pallidum as seen by dark field microscopy. What about the vertical transmission? مثل ما قلنا إنه vertical transmission means the transmission of infectious agents from the mother to her fetus. هنا شلون راح يكون؟ راح يكون through the placenta in the majority of cases because the spirochetes readily crosses the placenta. But less commonly, the neonate might become infected while it passes through the birth canal when it becomes in contact with contaminated lesions or across the membranes. هسه نجي نشوف ال stages of syphilis. Maternal syphilis طبعا stage according مثل ما تعرفون من ال يعني previous lectures أعتقد سابقا بالمراحل السابقة بالinfectious diseases بالmedicine إنه it is a stage according to the clinical features and disease duration into the following stages. Primary syphilis is diagnosed by the characteristic chancre ومثل ما تشوفون. It develops at the site of inoculation characterized by a raised red firm border and a smooth yellow coated base, and it is painless. This usually resolves spontaneously in up to 8 weeks. While the secondary syphilis is diagnosed when the spirochete is disseminated and affects multiple organ systems. مثل ما تعرفون after its entry it replicates and disseminates through the lymphatic channels into the different organ systems. The manifestations in secondary syphilis includes dermatological manifestations that presents in up to 90% of cases in the form of condylomata lata, which are flesh-colored papules and nodules found on the perineum and perianal area, and these are highly infectious. As well, syphilitic rash مثل ما تشوفون بهذا الفيجر هو يكون عبارة عن maculopapular rash affecting all the body including the palms of the hands and soles of the foot. As well as mucosal lesions might be a manifestation in secondary syphilis. As well, she may suffer from constitutional symptoms that affect 70% of patients with secondary syphilis in the form of generalized lymphadenopathy, splenomegaly, fever, malaise, anorexia, headache, myalgias, and arthralgias. What about the latent stage or latent syphilis? It develops when primary or secondary syphilis is not treated. This is characterized by reactive serological testing but resolved clinical manifestations. The fourth stage of syphilitic infection is tertiary syphilis. Tertiary syphilis هو شنو? It is a feature of syphilitic infection that appears after 15 years from the acute infection. It affects about 20 up to 30% of untreated women. This will be manifested either in the form of cardiovascular complications in up to 80%, خاصة affecting the aorta. As well, it may be manifested in the form of localized nodules with central necrosis, or the person or adults might present with a neurosyphilis. What about the mortality rate from untreated syphilis? It does not exceed 14% in general. For the fetal and neonatal infection, congenital infection حقيقة is uncommon before 18th weeks gestation. يعني مثل ما قلنا إنه the transmission rate يزيد، لكن ال congenital syphilis the severity of infection تكون أكثر the earlier in gestation it will be. لكن the risk of transmission is less during the first half of gestation. Once fetal syphilis develops, it manifests as a continuum of involvement in the form of fetal hepatic abnormalities, followed by anemia, thrombocytopenia, ascites, and hydrops. As well, the fetus might be born with no signs of life. That is to say, a stillbirth remains a major complication of syphilitic infection of the fetus. For the newborn, it may develop with the following features. It may be jaundice. There might be an evidence of jaundice, petechiae, purpuric skin lesions, hepatosplenomegaly, lymphadenopathy, hemolytic anemia, thrombocytopenia, rhinitis, pneumonia, myocarditis, nephrosis, osteochondritis, periostitis, etc. CNS involvement. حقيقة, features of neonatal infection might usually appear within 2 up to 8 weeks of life. What about the placenta and syphilitic infection? The placenta will be characteristically large and pale. يعني the appearance of the placenta will be suggestive of syphilitic infection. نشوفها أنه هي كبيرة وشاحبة. هذا الفيجر يبين لنا قسم من features of congenital syphilis مثل ما تشوفون اكو hydrops fetalis, rash, periostitis, osteochondritis, hepatomegaly, etc. What about late congenital syphilis? شنو معناتها؟ معناتها features of syphilitic infection اللي تظهر وراء تقريبا أسبوعين إلى 8 أسابيع after birth. هنا ما راح تظهر عندنا، لكن after 2 years of life and often in early adolescence, some of the features will be manifested. This includes Hutchinson's teeth مثل ما تشوفون هذا الفيجر، هاي صورتها. Interstitial keratitis, healed chorioretinitis, secondary glaucoma, corneal scarring, optic nerve atrophy. يعني هاي الفيتشرز كلها لها علاقة بالعين حتى لا تنسوها. بالإضافة إلى الهاتشنسون teeth. Saddle nose هذا يعني loss of the height of the nose. أعتقد كلكم تعرفون شلون يتبين صورة saddle nose. Eighth nerve deafness. كذلك mental retardation and convulsive disorders might be features that suggestive of late congenital syphilitic infection. All pregnant women should be screened for syphilis at their first antenatal visit. هنا عكس التوكسوبلازموزيس. مثل ما قلنا Toxoplasma screening is not recommended during a pregnancy, while for syphilitic infection, the guidelines stated that all pregnant women should be screened, and the screening can be repeated later on, depending, especially in those at risk. What about the diagnosis? مثل ما تعرفون إنه Treponema pallidum cannot be cultured from clinical specimens. But the definitive diagnosis of early stage lesions, يعني من عندنا الشانكر موجود, can be done by dark field examination and direct fluorescent antibody testing of the lesion exudates looking for the parasite. مثل ما راويتكم بالفيجر السابق شلون تبين السبايروكيت بالdark field examination. However, for screening purposes, يعني حتى نعرف أنه إحنا قلنا it should be screened during a pregnancy. أكو عندنا non-specific serological testing, but are used for screening, not for diagnosing the presence of syphilitic infection. This includes VDRL, أكيد كلكم سامعين به، كذلك rapid plasma reagent test. Both of these can be used for monitoring the serological response to treatment. They found that an initial titer of them of above 16 usually indicates active disease and the need for treatment. But there are specific serological tests for syphilis, syphilitic infection, اللي تكون most costly. Example of which is Treponema pallidum heme test. For the prenatal diagnosis, مثل ما قلنا إنه PCR هو gold standard diagnostic technique، لذلك نقدر نستخدمه for detecting Treponema pallidum in amniotic fluid and in the fetal blood that is obtained via fetal blood sampling عن طريق choriocentesis. However, the sonographic features that might be suggestive includes hydrops fetalis, hepatomegaly, placental thickening, and hydramnios. But unfortunately, they are often normal, and we cannot diagnose syphilitic infection from antenatal ultrasound scanning in most of the cases. What about the treatment? Treating the aim of a treatment and treating a woman with syphilitic infection, this of course is to reduce the risk of congenital syphilis and stillbirth, premature births, and neonatal deaths as well. As well, prevent progression of the disease from one stage into another, and from the primary stage into the secondary one, etc. Of course, we have not to forget that their partners should be screened and treated as well. What is the agent or drug of choice in treating syphilis? It is the benzathine penicillin G at a dose of 2.4 million units for all stages of syphilitic infection during a pregnancy. حقيقة احنا outside the pregnancy, this can be given as a single dose, but because of the altered hemodynamics during the pregnancy and because of the diluted blood and the reduced plasma concentration of penicillin, this dose should be repeated 1 week after the initial dose. Okay. أكو هنا مصطلح لازم تعرفون شنو what is meant or what we mean by Jarisch-Hexmeir reaction. Jarisch-Hexmeir reaction, it is a systemic reaction that affects up to 50% of women treated for early stage syphilis. It is characterized by transient, mild constitutional symptoms. Here, the complications might be occurrence of a preterm labor and fetal distress. لذلك احنا من ننطي treatment, we should carefully observe the mother for the possible development of this reaction. Okay. هسه حاليا اللكتشر انتهت. قبل لا ابدي اسالكم وترى الاسئله الاجوبه مالتكم دا اشوفها تسجل بالشات وتنخزن بالدرايف. ومثل ما قلت لكم بالمحاضرة السابقة أنه هاي المشاركة تعتبر فد بيس للتقييم، يعني احتمال تدخل بتقييمكم إن شاء الله يعني بالسعي. فإذا عندكم سؤال، يعني المحاضرة كانت واضحة؟ أكو أحد عنده سؤال؟ زين. تسمعوني؟
أي دكتورة نسمع.
نعم دكتور. أوكي. بالنسبة للسؤال الأول for the toxoplasma or toxoplasmosis, how can we diagnose acute toxoplasma infection during a pregnancy? تقدرون تجاوبوني بسطرين أو سطر واحد، يعني مختصر مفيد، مو الديتيلز. من خلال الشات. شوفوا يعني أحد، لا احنا ما نقول how we can diagnose fetal infection with toxoplasmosis، احنا بدنا نحكي عن maternal infection، لأن الفيتال infection هاي واحد. الفيتال infection حتى يعني تكون واضحة عندكم بشكل عام of any infectious agents تعتمد على شغلتين. الجولد يعني standard diagnostic test هو راح يكون عن طريق البي سي ار، عن طريق الدي ان اي amplification techniques، لكن الفيتشرز اللي لها علاقة بالبارتيكولار agent might be suggestive. هسه أنا دا أحكي عن الماتيرنال توكسوبلازما infection، شلون نشخصها؟ شوفوا أنا تعمدت أسألكم هذا السؤال لأن الظاهر أنتم مو كلش يعني مركزين بالمحاضرة وياي. الأجوبة قسم من عندها خطأ وقسم من عندها قريبة للصح لكن مو صحيحة. أول شيء مثل ما قلنا إنه can the parasite be isolated from the tissues or body fluids? Yes or no؟ بس جاوبوني على هذا السؤال.
No.
أوكي. فإذا نعتمد على شنو؟ على serological testing مو صحيح؟ زين مثل ما قلنا ال IgM إيش قد ممكن يبقى persistent بالجسم بحيث من نشيكن نلقاه موجود؟
من اسبوع الى اسبوعين؟
لا ال IgM من اسبوع الى اسبوعين does appear بعدين يزيد خلال شهر بعدين ورا الشهر persist for variable periods of time that may continue or may last even for a number of years. إذا تلاحظون يعني إذا هو يبقى سنوات هل يفيدنا في تشخيص الأكيوت انفكشن؟
لا دكتورة ما
أها. فإذا اللي جابوني الاي جي ام هذا غلط. زين هل الاي جي ام والاي جي جي إذا اثنيناتهم موجودين معناته عندنا أكيوت انفكشن اوف توكسوبلازموزيس؟ هم خطأ ليش؟ لأن مثل ما قلنا الاي جي ام قد يكون موجود for a number of years. زين في حالة وجود الاي جي ام واحدة الاي جي جي واحدة والاي جي ام نيجاتيف on serological testing هذا شو يعني؟
post infection
فهذا will exclude current infection with toxoplasmosis. يعني the presence of the toxoplasma IgG this will exclude recent infection with toxoplasmosis. لحد الآن واضحة الأمور مو صحيح؟ زين إذا نعتمد على شنو بالتشخيص؟ قلنا على ال IgG avidity مو IgM avidity. انتم قسم من عندكم جاوبوا لكن قريب للصح. ال IgG avidity شنو معناته؟ وشنو نقصد بال IgG avidity؟
الانتيجين انتي بودي
هو يعني عبارة عن وشنو يوصف ال strength of antigen antibody binding. فشافوا انه كل ما التايم elapsed from the from acute infection كل ما راح يصير عندنا زيادة بالاي جي avidity. فإذا with increasing time since the last infection there will be an increase in the IgG avidity. زين ومن اكو عندنا high avidity index هذا شنو؟ this will exclude شنو؟ الانفكشن within the last ايش قد؟
percent
اي؟
بالفيرست ترايمستر.
يا ريت تجاوبوني على الشات لان ها راح تثبت وراح تصير كريدتس لكم. وهسه راح اني ان شاء الله انزل لكم على اذا تحبون على الكلاس شلون جوابكم كان بالمحاضره السابقه. يعني كله يتنزل عندي بالدرايف كل واحد شنو اللي جاوب كم كل يعني على الاسئله اللي سالتها كلها كل اسم قدام الاجوبه مالته. عافيه. هسه احد جاوب صح اللي هو this will exclude عبد الله طبعا جاوب صح اللي هو this will exclude infection خلال يعني على الأقل 12 أسبوع سابقا يعني 12 إلى 20 أسبوع. لذلك إذا إحنا أول ترايمستر أول 3 أشهر اكتشفنا أنه المother is infected لكن شفنا الهاي there is high avidity index معناتها الانفكشن was acquired before pregnancy. أوكي؟ زين. بالنسبة للsyphilitic disease طبعا the causative agent تعرفون هو Treponema pallidum. How a human being or how an adult or how a person can become infected with syphilitic disease?
قاعد نعيد السؤال؟
إيه؟ How a person can become infected with syphilitic disease or how can they acquire Treponema pallidum؟ طبعا عن طريق intimate sexual contact مثل ما تعرفون. زين how the spirochetes can enter the body through شنو what is the يعني through the routes of entry؟ هل من خلال for example nasopharyngeal secretions، من خلال ال droplets الانفكشنز تكون هي صح by direct contact، لكن شلون تدخل؟ من خلال السكن لو من خلال أنا راح أجاوبكم من خلال minute abrasions in the mucosal tissue mucosal epithelium. يعني وين؟ من vaginal mucosa oral mucosa anal mucosa. زين at the site of entry what will develop؟ جاوبوني. At the site of entry, what will develop? At the site of or the portal of entry. إيش راح يصير؟ زين لحد الآن ما جاوبتوني على السؤال الأخير. شو يسموه lesion that will develop at the portal of entry؟
دكتور شانكر.
شانكر عافية. شنو what are the characteristics of شانكر؟ شنو صفاته؟
Painless.
painless this is one. بعد
Raised edges with yellow base.
raised firm red edges with a smooth yellow coated base. يعني هذا clinically يكون characteristic الappearance مالته. لذلك once a chancre is found this will be تقريبا diagnostic of syphilitic disease or syphilitic infection. زين من خلال الشانكر نقدر نشخص الsyphilitic infection via a certain test or a certain way of or method of examination. احنا صح قلنا هذا الappearance مالته is characteristic، لكن اللي support the diagnosis and confirm it شو نسوي للليجن اللي نقدر ناخذه من الشانكر للإكزوديت اللي نقدر يعني ناخذه من الشانكر itself؟ نقدر نشوف السبايرال كيتس وشلون بيا طريقة ايش نستخدم؟ مو طلعت لكم صورة اني شلون شكلها هالشكل ملولو والخلفية كانت سوداء، تذكروها؟
Dark field.
عافية. واحدة من عندها dark field examination والdirect fluorescent antibody testing هاي واحدة. زين في مالو ما شخصنا او ما لحقنا على الشانكر. الشانكر ورا ايش قد يختفي؟ ورا ايش قد الليجن هذا يروح؟
دكتورة يبقى تقريبا أسبوع إلى 5 أسابيع وبعدها يختفي؟
لا يبقى تقريبا من أسبوعين إلى شهرين. أسبوعين إلى شهرين حتى تحفظوها، من أسبوعين إلى 8 أسابيع. زين وراها ايش تبدي؟ هسه هاي البرايمري syphilitic disease ورا يعني primary stage. وراها ايش راح يبدي؟ تبدي secondary stage. زين شنو المانيفستيشنز of secondary syphilis عادة؟ يعني شنو هي الفيتشرز of secondary syphilitic infection؟ طبعا خلوا ببالكم انه تطور السيفليتيك انفكشن من مرحله الى مرحله راح يكون بسبب الان تريتمنت. انطوني features of secondary syphilitic infection. أحد يقدر يحكيها إذا يعني ما تقدرون تكتبوها؟
دكتور احنا دزينا لك اياها بس يجوز ده تتاخر. هو السكندري الكونديلومات والكونستيتيوشنال سيمبتومز.
عافية. الديرماتولوجيكال فيتشرز ايش تتضمن؟ وهاي طلعت لكم صور.
الكونديلومات 3.
كونديلومات 3 وهاي تكون highly infectious. This is one. بعد
mucosal lesion.
عافية. أنا خليت لكم 3 صور حتى ما تنسي بالإضافة إلى الكونديلومات 3 هاي لازمهم تعرفوها. خليت لكم صورة الباتشي ألوبيشيا مو صحيح؟ بالإضافة إلى السكين راش. السكين راش بالسفلس يكون كاركترستيك إنه شنو؟ It affects the palms and soles في أغلب الأحيان، في حين other rashes from other infections عادة ال palms وال soles is not affected. بيكون maculopapular. زين. الconstitutional تعرفوها أنتم. أوكي. زين. بالنسبة للكورونا فيروس. Coronavirus infection or COVID-19 infection in a pregnancy. Does this increases the risk of miscarriage حسب الجايد لاينز الموجودة حاليا؟ بس yes or no.
دكتورة قلنا لا ما يزيد.
ما يزيد. كتبوها بالشات لأن هاي راح تنحسب لكم بعدها هي أنت أجاوب تقريبا. زين عندكم سؤال عيني على أي شيء تحبون تعرفوه؟ أوكي هو وقت المحاضرة انتهى. تقدرون تاخذوا راحتكم يعني. مع السلامة في أمان الله.